Hi, Michelle. On further reflection, I wonder if we didn't put the video on Guy's phone. But anyway, it's a mystery, so I'm refilming this for you. So number one is to maximize pronation in both feet. You can stand and bring the knees together and out, together and out. Another way to do it is to do one leg at a time. So I'm doing my right leg, my right foot, and I'm pointing the left hip into external rotation. So visualize a axis going through the ankle, the knee, the hip, and the shoulder on the right. And you're going to rotate about that axis. So I'm turning left, okay? And modify, if you get any knee discomfort, just find that sweet angle. And then at the very end, you're doing little, tiny oscillations. And I can feel my heel going into valgus, and I can feel the arch dropping. You may not see that little movement, but 1, 2, 3, it's happening. And then, of course, to the opposite for the left side, okay? Next is once a week, you want to lay on foam for both hips. And I'll demonstrate on one. This one you need to do on a treatment table or lie on the floor. And you take the 2x4x8-inch foam and you locate the trochanter, okay? And then you put the middle of the foam under the trochanter and you slide it in so the foam is in line with the outside of the pelvis and thigh, okay? And I don't recall if we found, if you bend your little pinky, it should be at the bottom of the foam. I hope we did that. And then this one, you could lay on it for 2 to 3 minutes, and you can do it once or twice a week, and it does a really nice job of maintaining the correction, okay? And for any questions on any of these, reach out to me, all right? First I wrote them all down, and then I rearranged them, so I'm struggling a bit. Okay, number 3 is to do on an as-needed basis. You could palpate the pubic joint and palpate across the fibrocartilage at the upper third, middle third, and lower third. And if you find an asymmetry, such as a pure glide or a lower rotation or the fibrocartilage being posterior, then you lay on your back and you do this on both sides. And you take the foam and you place it horizontally under the lower third of the buttocks. It's right above the gluteal crease, so it's capturing the ischium. And you put foam on both sides and do that for 3 minutes. Okay? So I would test that every week for a couple of weeks. And if you go 4 weeks without needing to treat it, maybe then test it once a month. Okay? And I'm just going to go ahead and stop filming because this is a mess. I need to get them in a better